Hi everyone, and thank you for taking our CARS workshop, which stands for Controlled Articular Rotations. My name is Rebecca Grube, and this is David Albers, and we are both certified athletic trainers here at Cerner, working on our Motion Health program. So like I said, we're going to go through controlled articular rotations, or CARS, of every major joint of the body. A couple of principles that you want to keep in mind as you do this whole routine is to maintain whole body tension as we go through each specific rotation. So generally what that means is that we're going to make sure all of the muscles in our hips are contracted, we're staying strong through the legs, the arm that we're not working at the time is going to maintain tension, and all of that really is in an effort to minimize compensation from the rest of our body. So essentially all we really want to be moving is that specific joint that we're working at that time. As you go through each rotation, I really want you to try to reach the outer limits of that specific joint. And you'll find that there are different points of restriction. You're going to feel tightness, and I really want you to try to move into that tightness, but not so much so that you have to turn your whole entire body or you're compensating with some other joint. Okay? So let's get started. I want you to stand with your feet hip distance apart, arms are down at your sides, and we're going to start with the rotation of the neck. So we're going to bring your chin down to your chest. Chin goes over towards your right shoulder. You're going to tilt your head back, chin over towards your left shoulder, and then down. And again. Really, again, make sure that you're reaching those outer limits of that range of motion. Really trying to maintain tension in the muscles of your neck, and opposite direction, chin over towards the left shoulder. Now, if you feel a pinching type of pain as you close this angle, I want you to just bypass that angle and continue to circle. And last time, over towards the left shoulder, or right shoulder, sorry, and then back down. Okay? Now we're going to work the middle part of our spine, or the thoracic spine. So arms are going to be across your chest. And here you really have to maintain some good tension in the hips. One of the common compensations I see a lot of people make is that they rotate their hips with their spine. You want to keep your hips pointed straight forward. This is a really subtle movement here. You're just going to round your shoulders forward, and you're going to rotate your torso towards the right. Maintaining those hips straight forward. You're going to crunch down into those right ribs, really opening up on the left side. Squeeze your butt as you lean back, crunching down into the left ribs, opening up the right, and back to center. And again, rotate towards the right, opening up those left ribs, squeeze your glutes as you lean back so that you're not using your lower back to help you, and then back to center, reverse direction. You're going to rotate towards the left, crunch down into those left ribs, really opening up the right this time. Lean back, squeeze down into the right ribs, back to center, and then one more time to your left, rotate, opening up the right ribs, lean back, opening up the left ribs, and back to center. You can also do that particular one in the kneeling position, which even further restricts movement from your hips. Shoulders. Take your left hand, place it in a fist. Your right palm is going to be facing your side. We're going to work our right arm first. Bring your arm straight up in front of you. Really squeeze your glutes here. Rotate the hand out. Now you're going to extend the arm. Again, trying not to rotate your torso. You're going to see mine and David's hand is going to slowly rotate so that my thumb is pointed towards the back of the room, and eventually my hand will be facing out, my arm back at my side. Go ahead and flip the hand back over to the start position. One more time. All the way up. Rotate that hand out. Continue maintaining tension. And again, really looking for where is your outer limit of that range of motion. Really fight for those degrees. Keep rotating that arm so that palm faces out once your arm is back at your side. Now we reverse the direction so the palm stays facing out. Lift your arm straight back behind you. So you kind of reach that stop point and then begin to lift your arm. Begin to rotate that arm. You'll notice that your muscles in the back of your shoulder are working pretty hard here. Keep rotating that arm until the palm is facing in and the arm clears the ear. Last time, palm faces out, lift straight back. This is a really tough movement here. So just work on maintaining control. Keep squeezing your glutes. Keep generating tension in the left arm. And keep rotating and extending that arm up until the palm faces in and the arm clears the ear. Other side. So right hand is in a fist now, really generating tension in this non-moving arm. Left hand is going to be facing your side. And again, lifting the arm straight up. Rotate that arm out and begin to extend. Now, if you feel pops or cracks in your shoulder, like I often do, that's okay. As long as it's not a painful pop, we're typically okay with it. Okay, flip that hand back over. One more time, lift it straight up. And check yourself every once in a while that you're not flaring your ribs out too much. Try to keep those ribs down. Keep rotating that arm. You'll see with David how he's really rotating that arm, looking for that space where he can extend that range of motion even more. Once the palm is down back at your side and facing out, I want you to extend the arm straight back. Again, until you kind of reach that stop point and begin to lift the arm. Really generate tension in that right arm here. Keep rotating the arm until the palm is facing in and the arm clears the ear. And one more time, palm faces out, straight back, begin to lift. If you feel any mild muscle cramps in the back of your shoulders, that's completely normal and actually a pretty good thing. That means that you're developing some more motor control and you're kind of turning on those motor units that maybe haven't been accessed in a while. Okay, so the next one is the shoulder blades. Okay, for this one, we're going to go ahead and face the side so that you can see what we're doing in the camera. Our left hand is going to be in a fist here. Right palm is facing our side. And again, generating tension. For this, we're really moving that shoulder blade. So it's not so much the shoulder this time. You're going to try to press your shoulder towards the wall in front of you. So you're really going to feel a contraction in the front of your chest. Now try to pull the shoulder up towards your ear. And now I'm going to think about pulling the shoulder in towards my spine, but trying to keep this shoulder relaxed. Now I'm going to think about pulling my shoulder blade into my back pocket. Okay? And again, in front, up towards the ear, back towards the spine, and into my back pocket. David, I'm going to have him stay facing this way. I'm going to face you, and we'll go the opposite direction. So one thing I want you to maintain as you're doing this is palm by the side. Sometimes when we lack control in the shoulder blade, people will have the tendency to bring the hand forward or even the hand back. So again, opposite direction, shoulder blade goes down into that back pocket. Now I'm pulling the shoulder in towards my spine, up towards my ear, and towards the front of the room. Try to make it a smooth circle. Back pocket, spine, ear, front of the room. Okay, switch sides. And again, left shoulder, pressing it forward, up towards the ear, back towards my spine, really feel that contraction there, and down into the back pocket. That's typically where I feel pretty good muscle cramp. Front, up towards the ear, back towards the spine, and into the back pocket, and then reverse direction. Into the back pocket, pulling it in towards my spine, up towards the ear, front of the room, last time, back pocket, spine, ear, and then front of the room. Awesome. Okay, we're going to do a couple of quick things with the elbows and the wrists. A lot of our associates have issues with elbows and wrists because we're on computers all day long. So left hand is going to be, actually we'll go ahead and do both at the same time. So you're going to start by locking your elbows into your sides, and I want you to turn your palms as far out as you can, okay? Now, while maintaining that tension, I want you to bend your elbows all the way up, okay? So it's a full bicep curl, and then you're going to turn your palms out so they're facing away from you, and then straighten the arms completely. And again, open up the palms. Keep generating and maintaining tension throughout the entire movement. Palms down. And once your elbows are all the way straight, then I want you to keep the palms facing this direction. And now bend the elbows. And then you'll rotate the hands so they're facing you. And really maintain tension as you straighten those elbows. One more time. Palms down, away from you. Bend the elbows. And all the way out. And down. Good. Now for the wrists. This one really is best if you can place some sort of object on your forearms to make sure that your forearms don't rotate, because this is really about the wrists themselves. So again, elbows into the sides, elbows are bent. You're going to bring your pinky finger towards your arm. So rotate your hands in, and I want you to extend your hands down. And really watch to make sure that you're not rotating those forearms. It's kind of a hard thing to ensure. And then bring your hands up. You'll kind of notice that it's difficult during certain portions of that rotation. And again, hands go in, extend down, nice and slowly. Pull the hands out, and then straight back up. One thing you want to watch for here is that you don't kind of have a claw hand as you raise the hands up. It's pretty common. Okay, reverse direction. So the hands stay up and they pull out. Try again to really maintain a flat forearm as you extend the hands down. Bring the hands inside. Pull up. And out. And notice one hand versus the other. What differences do you feel? Do you better control over one than the other? Okay, now we're going to go to the lower extremity. I want you to come down to your hands and knees, and just like we generate tension in the rest of the body through the upper extremity, we're going to generate tension in the arms as we work on the hips. Okay, so your elbows should be straight here, and hands just underneath the shoulders. Knees are just underneath the hips. We're going to work the right hip first. And here again, just really make sure that you're only rotating the hip. One of the compensations I see a lot of people making when they reach kind of a tight, stiff point in the hip is that they rotate the whole pelvis up. And I'll show you what that looks like here in just a second. So with the right leg first, we're going to bring the heel up towards the ceiling. We're going to rotate just through the hip, bring the knee towards the ceiling. Keep that knee as high as you can as you pull the knee in towards the armpit and down. And you'll notice that we're going pretty slow here. That's on purpose. Again, really trying to develop control. Knee out, knee towards the armpit, and down. and reverse direction. So knee comes in towards the armpit. Really watch your elbows here, tight sticky corner as you bring the knee out to the side. Keep the knee up high as you rotate and pull the leg back behind you and through. One more time, knee in towards the armpit, knee straight out to the side. Keep that knee up high as you pull the leg back behind you and through. Okay, now we're going to do the left leg. Again, watch the other elbow. I didn't mention that with the right leg, but the opposite elbow oftentimes wants to bend here. Okay, left heel up towards the ceiling. Rotate through that hip, bring the knee up towards the ceiling. Watch that right elbow as you bring the knee in towards the armpit and down. And again, heel towards the ceiling, knee towards the ceiling. Knee in towards the armpit and down. Reverse direction. Knee in towards the armpit, knee straight out to the side. Keep that knee up high and really move into that space as you pull the leg back behind you and through. One more time. Knee in towards the armpit, knee straight out to the side. It's pretty tough, and I know it's uncomfortable. And pull that leg back through. Okay, so now you're going to go ahead and sit down, and we're going to work on the knee. Go ahead and bring your left leg in front. You're going to loop your left arm underneath, grab onto your other bicep, and bring your hand over top of your knee. So you're kind of doing like a headlock to your knee. Pull the thigh up into your chest, and I want you to bend the knee as far as it'll go. You're going to rotate that lower leg inside and try to push the outside of your foot up towards the ceiling. And then rotate your lower leg out. Pull the outside of the foot towards the ground. And again, outside of the foot up towards the ceiling. And then outside of the foot towards the ground. Reverse direction. So the inside of the foot is going to go up towards the ceiling. And inside of the foot towards the ground. Really try to maintain tension throughout the entire movement here. And inside of the foot towards the ground. And go ahead and switch legs. So your right leg's in front, loop your right arm underneath, grab that other bicep and create that headlock with your knee. Pull the thigh up into your chest and bend the knee as far as it'll go. Rotate the lower leg and foot inside, trying to push the outside of the foot up towards the ceiling. Rotate it out, pulling the outside of the foot towards the ground. One more time. And you may notice a lot of cracking or popping in your knee. That's generally okay. I have quite a bit myself. Go ahead and do the opposite direction. So the inside of the foot goes up towards the ceiling. Inside of the foot towards the ground. One more time. Up towards the ceiling and down towards the ground. Good. Last one. We're going to work on the ankle. So go ahead and straighten your left leg, and we're going to work the left ankle. I want you to place your hands on your left leg just to ensure that you don't get any rotation that's coming from the entire leg. We don't want the hip to compensate for a lack of mobility in the ankle. So I'm going to maintain some pressure here just to make sure that I am honest with my ankle. You're going to pull your foot all the way up towards your nose and rotate your foot inside, trying to curl the toes and point the foot down. Really try to maintain control here as you pull the foot outside and then extend the toes back up towards your nose. And one more time. You'll notice that we're going about this pretty slowly, but that's because I'm really trying to assess how does my range of motion feel. I'm scanning for any restrictions that I might feel. Rotate to the opposite direction now. Foot goes outside. I'm really trying to curl those toes and keep them curled as I point my foot down. This often causes a little bit of a muscle cramp in the arch of your foot. That's okay. Really try not to pull away from that muscle cramp if you feel it. Try to sort of move into that space, as uncomfortable as it might be. It's really essential for developing that motor control in the foot and ankle. Go ahead and switch sides. Okay, again, find your position and then pull your foot up towards your nose. Rotate the foot inside, curl the toes, point the foot down, and continue the circle. I find a lot of patients that I work with that have a lot of plantar fasciitis issues, even bunion issues, shin splint issues. They have a lot of deficits in their balance, and go ahead and go the opposite direction, and kind of in the motor control or the strength of the small little muscles in their feet. So this is a really great way to work on that. You can do this even when you're just sitting watching TV at night. And last time, all the way around. Good. David got a muscle cramp. So muscle cramps, like I said again, are really common with a lot of these rotations. They, again, are really a good thing because you're accessing some of those motor units that you probably haven't accessed before or in a really long time. So continue to work on this. This is one of those routines that personally I do every single day. I recommend all of my patients to do every single day. You don't have to take it quite as slowly as what we did. You can do just, if all you have time for is one rotation in both directions, that's great. Any investment that you make into working on these rotations daily or just your mobility daily will really go far in improving your overall musculoskeletal health. For more mobility workshops, check out our others on the lower extremity, the upper extremity, and the spine. And if you haven't had a chance to assess your mobility, make sure you check out that workshop as well. Thanks for participating and have a great day.